I am Joan Morgan-Wazybok. I am 50 years old. I've lived in Wilmington for the last 25 years, and I did grow up in Philadelphia, Pennsylvania. I never had regular dental care growing up. My parents were quite ill, and it was just something we did not do. And so I think that my tooth problems were a lack of, because of neglect, and then it snowballed into fear and also shame. And I have 3 children, and when my daughter was 6 years old, it was her first trip to the dentist, and that was the beginning for me, because I felt like as a parent I can't tell my daughter what to do without me doing it myself. My smile was not grotesque looking, but if I would have an all-out smile, it would be more noticeable. And I think there was a turning point in my life when somebody commented on my missing teeth and said cruelly to me, "When are you going to get those teeth fixed?" I mean, it was a group setting and everybody stopped talking, and I just felt I was mortified that somebody would do that to me. And well, anyway, I will never forget that moment, but I think for me too, going to the dentist regularly because of my children, and I myself started going too, and all of my decayed teeth, my rotten teeth were removed. And it was a kind and caring dental hygienist who I still see regularly, and she was persistent and gentle. And she would ask me, "Have you given any thought to replacement teeth options, dentures, bridges, or dental implants?" My hygienist at Dr. Pierpan in Hampstead, her name is Janice Carver Jensen. I had been seeing her for years. And she is a kind and caring woman, and she was always persistent in asking me, "Have you given any thought to replacement teeth options, whether they are bridges or implants or whatever?" And she never gave up on me. She asked, and she said to me, I think this may have been made the difference. She said, "You don't have to make a commitment at this point. Just go and talk to somebody and see what they can do for you."
How did you like the explanation of the procedures once you got here? Did they tell you in detail what to expect?
Oh, it was in great detail. And once again, I don't think I had the fear of dentistry. Of course, the cost frightened me a little bit because I thought I would be taking away from my young family. And then I realized, though, it didn't have to be done all at once, and it was going to be over a series of years. So it was manageable for us. Oh my goodness, between Susan and Dr. Cook, I remember perhaps it was sitting in this office, and I had had the preliminary exam with the, is it called the ICAT? And just an oral evaluation, the x-rays, and then they discussed a course of treatment for me.
When did you start your course of treatment?
It was April of 2006 is when I met Dr. Cook, and it also included orthodontics with Dr. William Geary, also a kind man. So I was on the journey with all 3, Drs. Pierpan, Geary, and Dr. Cook. And I didn't have to go that extensive a route, but again, after careful consideration of what I was embarking on, I could have just opted for the implants, but they had told me that if I would ever consider teeth straightening, and again, they weren't bad, but because I had so many missing teeth, there was shifting of my teeth. They just said, certainly you can't change your mind once the implants are in place. So
well, you certainly got a nice smile now. It looks like it paid off.
Oh, it did. Thank you very much. And just most importantly for me, as I said, I think the biggest factor was the feeling of shame that I felt. And I've always wanted to have that big smile if something strikes me as funny, or, you know, laugh till I cry. But I became masterful at disguising my smile or covering up, and I just felt like that was a heavy burden to carry with me for the rest of my life, and I just said, I don't want to do that anymore. So I am going to seek help. And and you know what, once I kind of revealed that to Dr. Cook, I remember I sat here and I cried, but it just seemed like it was the beginning of something for me. Like, so what? Cry, let it out, and let these good people help you, which they did. Very much so. I would say that having had tooth extractions and living through toothaches, that was more uncomfortable. The procedures they explained to me prior to them and They told me what I would expect afterwards. It was minimal, no discomfort, nothing.
Good.
I had to be careful with my aftercare, the oral, the hygiene, and keeping the surgical areas clean. And then I was back for regular post-op visits.
How long did the entire series of procedures take?
For me, start to finish, 4 years.
And you would come in every 3, 4, 5 months, something like that?
I would. I had 3 surgeries. The biggest one was, that included 2 sinus lifts and then the 3 implants. And then there was a period of healing. And meanwhile, see, I was in braces. So I had that the Whopper surgery first. And then it was very exciting between Dr. Geary and Dr. Cook, just watching the transformation of my mouth, the teeth shifting and then the implants. And then the healing had to take place. So I did have 3 surgeries here. And once I was cleared for going back to my primary dentist, Dr. Pierpan, that's when the restoration began. And that took from September to April. That was a very long journey, and probably more frequent visits to the dentist, because I had to have 8 teeth. That's how many implants I have. I have 8. This was a 4-year journey for me, from April of 2006 till April 2010 of this year. I guess I got my last tooth seated, and I'm still going through adjustments.
Well, that can take a lot of courage to make that first step. What was it that made you take the big step?
Just deciding that I was tired of guarding my smile and feeling that shame. I didn't want to feel that anymore. Like I said, if something strikes me as funny, I want to laugh out loud and let it go. It wasn't so much the eating. I don't care so much about that issue. I know that did, because over the years I had learned to adapt. But it was more for the appearance and just feeling better about myself.
Were your kids proud of you?
Very much so. My son, who is now 11, starting 4 years ago, he would always make me feel better by calling me sparkle teeth because of the braces, and he would always tell me I'm the prettiest mom in the world. And it was no big deal to them when I would go to the dentist, or I would kiss him goodbye when I drop him off at school, and I would say I would be back, and he would tap me on the shoulder when he got out of the car and say, "You'll be fine." And see, none of these kids have had cavities, so I am doing right by them by getting them the regular dental care, but I also needed to do that for myself. I just think for me, because my parents died young in their 50s, and I started this process of thinking about this journey in my 40s, and I told myself that I did not want to wake up when I was 50 and regret not doing it. And so here I have turned 50, and I am so glad that I did. And again, maybe there is that one person along the path, as it was for me. It was Janice Jensen. Again, persistent and gentle, and I felt she was not judgmental, but she was somebody behind me who never stopped caring about me and said, just go and talk to somebody. And that's what I would recommend to somebody. Don't look at the big picture and how am I going to pay for it, what's it going to feel like. Just go and talk to somebody. And then if you place yourself in their caring and capable hands, let them guide you along, as Dr. Cook and all of the assistants did for me here. Dr. Geary and his staff, I feel like I know many of them very well. And Dr. Pierpan also, all of them, they were all rooting me on. So I know that they're all very happy for me, and even the dental assistants, and calling me by my first name. You know, just really happy when I come in and how are you doing?
Excellent.